Hello, everyone. Look, we've all been there, right? You go to the Klinik Kesihatan, you take a number, and then you just wait and wait and wait some more. It's a national pastime, but guess what? Things are finally changing. Your local KK is getting a pretty serious upgrade, and today we're going to break down exactly how it's going to save you a whole lot of time. Let's get into it. So here's what we're covering. First, we'll talk about the problem we all know and hate, the crazy long waits. Then I'll show you how your phone can help you skip the queue entirely. After that, we'll look at how you can see a doctor without even leaving your house. And then we'll dive into the big future plan, turning your KK into a sort of mini hospital. Finally, we'll put it all together. All right, let's dive into section 1. We have to start with the problem itself, right? The long wait, the packed waiting rooms, the feeling of your whole day just slipping away. Yeah, we all know it too well. I mean, seriously, who actually enjoys this part? You spend maybe half your day there just to see the doctor for 10 minutes? It's been a frustrating part of our public healthcare system for ages. But here's the thing, it's not just you and me who feel this way. That's right. The health minister himself, Datuk Sri Dr. Zulkifli Ahmad, has said it out loud. Our government facilities are bursting at the seams. They're overloaded. And when the top boss admits there's a problem, that's usually when you start to see some real action. So what's the first big change? Let's get to the good stuff. The first solution is already here, and it's probably in your pocket right now. This is how you can use your phone to basically get your time back. Remember this app? Yep, MySejahtera. During the pandemic, it was all about checking in. Well, now it's become this super powerful tool to cut down your waiting time. Since January 2023, the Ministry of Health has rolled out an appointment booking system for all Klinik Kesihatan, and it's built right into this app. And booking is so easy. You just open the app, tap appointment, and follow the steps. Choose who's going, what service you need, find your clinic, and then, this is the best part, pick a time slot that actually works for you. Confirm, and that's it. No more waking up super early to queue for a number. You can book your spot from your sofa. And look, this isn't just for a simple flu. You can book all sorts of things. Regular checkups, family planning, even those pre-job or pre-study medical checks. You've got health screenings like PKF40, minor things like getting a wound dressed, and you can even book your government dental checkup this way now. The main point is, the power to skip that horrible queue is literally in your hands. Hey, if this breakdown is giving you a clearer picture, do me a favor and hit that like button and subscribe. That way, you'll always stay ahead on Malaysia's biggest issues. Okay, so booking your spot online is a game changer. But what if you could skip the trip to the clinic altogether? Well, that brings us to our next point, virtual consultations. So, what is a virtual consultation? Don't worry, it sounds more complicated than it is. It's basically a video call with your doctor using something simple like Google Meet. You get to talk to them face-to-face, live, without ever having to leave your house. It's a huge part of the government's push to make healthcare more digital. Now hold on, this service isn't for a brand new mysterious illness, okay? It's mainly for follow-up care. As you can see here, it's perfect for existing patients, especially if you have a stable chronic condition like diabetes or high blood pressure. And you can use it for things like going over your lab results, getting advice on your medication, or for follow-ups if you're a new or expectant mom. It's all about making ongoing care way easier. And the benefits are pretty obvious, You save time, you save money on petrol and parking, you don't have to go sit in a crowded clinic, which, let's be honest, is just safer for everyone. And best of all, there's basically zero waiting time. It just makes healthcare so much more convenient. Okay, so these digital tools are awesome for what we can do right now, but the health ministry is also thinking about the long game. They've got a really big, ambitious plan to upgrade the actual clinics themselves. See, the ultimate goal here is to fix the congestion problem for good. And the big idea is to turn many of our existing Klinik Kesihatan into something they're calling cottage hospitals. It's an idea they've seen work in other places, like the UK, to bring more advanced care closer to where people actually live. This slide really shows you the difference. Today, your KK does basic stuff, and for anything more serious, you get referred to a big hospital. But in this future cottage hospital, that same clinic could do minor surgeries, have a few beds for people who need to stay a night or two, and even have family medicine specialists right there. It's about turning your local clinic into a mini hospital, which takes a huge load off the major hospitals. And this isn't just some dream they're talking about. There's a real plan. The MySejahtera booking system, as we said, started back in 2023. The minister has already announced this cottage hospital plan, and they're set to start the early planning for it in 2026. It's happening step by step, but the ball is already rolling. So we've looked at the digital tools, we've looked at the future plans. Let's bring it all home and talk about what this really means for you and your family on a day-to-day basis. All right, let's do a quick recap. The big problem? Our clinics are way too crowded. Solution number one that you can use today: use your MySejahtera app to book a slot and skip the queue. Solution number two: use virtual consults for your follow-ups so you don't even have to go. And the future to look forward to? Your local KK getting upgraded into a mini hospital with more services right in your neighborhood. You know, you can join thousands of other Malaysians who want clarity, not confusion. Just tap that like button, hit subscribe, and let's take making sense of all these big changes together. And that's pretty much it. It's clear that with a mix of smart tech and long-term planning, our public healthcare is really starting to evolve. Which brings us to a final question for you. What other part of Malaysian life do you think desperately needs a digital upgrade like this? Let us know what you think in the comments below. Thanks for watching, and I'll see you in the next one.